عليكم السلام دكتور.
اليوم شباب نكمل لكم اي شويه تريتمنت اوف ulcerative colitis، ومثل ما قلنا تذكروها الulcerative colitis ذاك الاسبوع. قلنا according to the severity اكو mild moderate و severe. التريتمنت according to the severity medical treatment of the acute attack. Corticosteroid is are the most useful drug. Steroid is the useful drug, which is either locally or for inflammation for the rectum, or systemically when the disease is more extensive. One of the 5 amino salicylic acid (ASA) derivative that include sulfasalazine, mesilazine. Okay, derivative can be given both topically or systematically. Their main function is to maintain remission rather than treatment of the acute attack. So the acute attack treated by steroid and the maintenance by one derivative of 5 ASA. Non-specific anti-diarrheal agent have no place in the routine management of the ulcerative colitis. Mild attack starts by prednisolone, oral prednisolone 20 mg per day, that given for a 3 to 4 weeks period. One of the 5 ASA compounds should be given concurrently to maintain remission. Moderate attack, increase the dose of prednisolone to 40 mg per day, twice daily. Steroid enema and 5 ASA can be given to maintain remission. Severe attack is considered as a medical emergency that require admission to the hospital, and it's important to monitor the vital sign of the patient regarding pulse, temperature, and blood pressure. A stool chart will be kept, and increasing abdominal girth through the abdominal examination is a potential sign of toxic megacolon to happen. A plain abdominal radiograph is taken daily and inspected for the dilatation of the transverse colon for more than 5.5 cm. There is sign of colonic perforation within the X-ray, include mucosal island, intramural gas, or on the plain X-ray, increasing colonic diameter or sudden increase in the pulse temperature that may herald the development of peritonitis due to colonic perforation. A fluid and electrolyte balance is maintained, anemia is corrected, and adequate nutrition is provided. Sometimes the patient needs parenteral nutrition. Patient is treated with intravenous hydrocortisone, 100 to 200 milligram 4 times daily, and there is no evidence that antibiotic modify the course of severe attack. So the antibiotic does not have a role in management of ulcerative colitis. على العكس من Crohn's disease هسه ناخذها انه there is a role of antibiotics, especially in the presence of the abscess in the Crohn's disease. Some patients are treated with azathioprine or cyclosporine A to induce remission. If there is failure to gain improvement within 3 to 4 days, then surgery may be seriously considered. Prolonged high dose of steroid يحمل الكثير من الcomplications. عادة ندخل complication of the steroid. What are the indication of surgery in patient with ulcerative colitis? First one is severe fulminant disease or toxic megacolon. Chronic disease with anemia, frequent stool or urgency, and tenesmus. Steroid-dependent cases. This is not severe, but remission cannot be maintained without substantial doses of steroid. So the steroid-dependent disease is one indication of surgery. The risk of neoplastic changes, especially during colonoscopy, we found severe dysplasia or metaplasia. Extraintestinal manifestation, skin, liver, okay, biliary, even anal. This is an indication for surgery. Rarely severe hemorrhage or stenosis causing obstruction rarely is indicated for ulcerative colitis for surgery. What are the operation of the ulcerative colitis? The first aid procedure is a total abdominal colectomy and ileostomy. This has advantage to stabilize the patient quickly, and histologically of the resected colon can be checked, and the restorative surgery in the second procedure can be attempted at a later date. Second procedure is a proctocolectomy and ileostomy. This is the procedure associated with the lowest complication. It is indicated in patients who are not candidate for restore, يعني يبقى على ileostomy. Okay. The third operation is the operation of choice, which is called restorative proctocolectomy with ileoanal pouch. In this operation, a pouch is made out of ileum as a substitute for rectum. Okay, because resection of the rectum and a pouch, ileal pouch, to substitute the rectum and then sewing or staple to the anal canal. Okay, this is avoid permanent stoma like the second procedure. The fourth procedure is colectomy and ileorectal anastomosis. When there is minimal rectal inflammation, مثل ما قلنا احنا ulcerative colitis affect merely rectum and go up. If there is minimal rectal inflammation, the rectum will be not removed. Just colectomy with ileorectal anastomosis. This is occasionally be used because مثل ما قلنا rectum is, almost always is involved. Sometimes the surgeon look rectum is normal due to steroid enema. Okay, that is the inflammatory process in the rectum will be minimal due to steroid enema. Ileostomy with continent intra-abdominal pouch. The reservoir is made for 30 cm of ileum, and maybe beyond this spout is made by inverting the efferent ileum into itself to give continent valve just below the skin level. عادة الكوخ procedure is made by last 3 cm of the ileum, okay, to reservoir and make up spout اللي هو at the end of ileum to prevent complication of ileostomy to the skin called ileal spout. Okay, this is the operation of the ulcerative colitis and indication of surgery in case of ulcerative colitis. The second inflammatory bowel disease is Crohn's disease, previously called regional enteritis. This can be affect any part of the gastrointestinal tract from the mouth or lip to the anal margin. But ileocolonic disease is the most common presentation. ولذلك اسمها القديم اسمها regional ileitis. It is most common in North America and Northern Europe and incidence of 5 كل 100,000. Okay, it is slightly more common in women than men. إذا تذكرون ulcerative colitis is equal in men and women before 40 and become more common in men above 40 years old. But it is most commonly diagnosed in young patients between the age of 25 to 40 years old. What is the etiology of the Crohn's disease? Crohn's disease has some features suggest chronic infection, but there is no causative organism be found in patients with the Crohn's disease. Similarity in the Crohn's disease and TB have focused attention to the mycobacterial as a cause of Crohn's disease. And especially when the DNA of Mycobacterium paratuberculosis in the intestine of 60% of the Crohn's disease is found, but no immunological reaction, and the treatment of the TB have no effect on patients with the Crohn's disease. A focal ischemia, another hypothesis of causative factor of Crohn's disease. Focal ischemia also being postulated as a causative factor, possibly originating from vasculitis arising through an immunological process, okay, which is more accepted hypothesis for pathogenesis of Crohn's disease. Smoking increases the risk. بالعكس ulcerative colitis قلنا protective. Genetic factors are thought to play a part مثل ulcerative colitis, but not direct Mendelian بعدين مثل ما قلنا. About 10% of patients with first degree relative with the disease have Crohn's disease. There is an associated with ankylosing spondylitis. As with ulcerative colitis, is now believed that Crohn's disease can predispose to cancer. حال ulcerative colitis, Crohn's disease is a pre-malignant condition of the colon. What are the pathogenesis? In the ulcerative colitis, there is thought to be an increased permeability of the mucous membrane, producing inflammatory changes, usually induced by cell-mediated immunity. This result, the release of cytokine, pro-inflammatory cytokine, like interleukin-2, tumor necrosis factor, with coordinate local and systemic response. In Crohn's disease, there is thought to be defect in suppressor T cell. Ileal disease is the most common. 80% of cases that involve the ileum. 30% of Crohn's disease are limited to the large intestine. And reminder, about 10% are in the patient with ileal disease alone or more proximal small bowel involvement. Anal lesions are common. Crohn's disease of the mouth, esophagus, stomach, duodenum is rare or uncommon. Resection specimen show fibrotic thickening of the intestine wall with a narrow lumen. There is usually dilated gut just proximal to the structure. And the structure area, there are deep mucosal ulceration with the linear or snake-like pattern. Edema in the mucosa between the ulcers give rise to the cobblestone appearance. الكوبلستون يعني شلون القاع المفطرة، قاع طينية مفطرة يسمونها cobblestone appearance. Transmural inflammation lead to the adhesion and then inflammatory masses with the mesenteric abscess and fistula into adjacent organ is occurring in Crohn's disease. واضح؟ Mesenteric lymph adenopathy and the condition is discontinuous. The inflamed area separated from normal intestine, so-called skip lesion. يعني normal, abnormal, normal. هذه يسمونها الباتين is skip lesion. There are non-caseating giant cell granuloma, which is specific for Crohn's disease rather than ulcerative colitis, but they are only found in 60%. مو كل مريض Crohn's disease عنده giant cell granuloma موجودة بس 60% of patients. What are the clinical picture? The presentation of Crohn's disease are either acute or chronic. Acute Crohn's disease, which occur in 5% of cases, symptom and sign resemble or similar to that of acute appendicitis, but usually preceded by diarrhea. Okay, acute colitis with or without toxic megacolon can occur in Crohn's disease, but it is very less than ulcerative colitis. So the presentation of Crohn's disease acutely similar to the right iliac fossa pain, similar to that of acute appendicitis. The difference, the diarrhea is associated with the Crohn's disease more than appendicitis. What about chronic Crohn's disease? There are often history of mild diarrhea and extending over many months, occur in both accompanied by intestinal colic, يعني abdominal pain with the mild diarrhea, usually complain of particularly in the right iliac fossa pain. Tender mass may be palpable, intermittent fever, secondary anemia, weight loss are common in chronic Crohn's disease. Perianal abscess or fissure may be a first presenting feature. After months of repeated attack of this attack of abdominal pain, diarrhea with acute inflammation, the affected area of the intestine became too narrow and fibrosis, causing obstructive symptom as a case of intestinal obstruction. But the progressive of the disease, adhesion and transmural fissuring, intra-abdominal abscess with the fistula to the adjacent organ. What are these fistulae? Fistula to the bowel, someone antero-enteric fistula, can occur into adjacent small bowel. Of the pelvic colon, anterovesical to the bladder may cause repeated urinary tract infection, even hematuria. Enterocutaneous fistula is very rarely occur spontaneously, usually occur after surgery to the skin, okay? And so the anterior fistula is very common. Fistula to the urinary bladder can occur, and fistula to the pelvic colon can occur. Fistula to the skin is very rare spontaneously, unless due to surgery. واضح? What are the investigation of Crohn's disease? Investigation start by laboratory CBC done for the patient to exclude anemia, and usually there is fall in albumin, magnesium, and zinc and selenium in patients with a chronic Crohn's disease, especially in active disease. Protein level that correspond to the disease activity, usually C-reactive protein is usually indicate active Crohn's disease. What about endoscopy? Sigmoidoscopic examination may be normal or show minimal involvement. مثل ما قلنا, sigmoidoscopy will examine the anal canal, rectum, and sigmoid. Sometimes it is normal, not affected by Crohn's disease. Regional ileitis is the most common. However, ulceration in the anal canal will be readily seen if there is anal presentation of the Crohn's disease. As a result of discontinuous nature of the Crohn's disease, there will be area of normal colon or rectum. In between these, there are area of inflamed mucosa that irregular and ulcerating with a mucopurulent exudate from this area of inflammatory process. Regarding imaging, barium enema will show a similar feature of those colonoscope in the colon. The best investigation of the small intestine is small bowel enema. The contrast study of the small bowel called small bowel enema. This will show up area of delay and dilatation. Because narrowing and dilatation will be show area of narrowing and dilatation. The involved area tend to be narrow, irregular, and sometimes when the length of the terminal ileum is involved, called a string sign of contour. When the terminal ileum is involved, it's called string sign of contour. Sinography or sinogram are usually useful in patients with enterocutaneous fistula. CT scan is used in patients with fistula and those with intra-abdominal abscess. When there is intra-abdominal abscess, يفيدنا CT scan. And MRI usually preserved for patients with anal or perianal disease. So the barium enema may be normal. Small bowel enema is positive in patients, especially when involved bowel show narrowing and irregular with the dilatation, and if the ileum is involved, called string sign of contour. CT is preserved for when there is intra-abdominal abscess and fistula is involved, where MRI is preserved for perianal disease of the Crohn's disease. واضح شباب? This is a barium or small bowel enema showing a contour sign, string sign of contour, اللي هو due to involvement of the إذا شايفين الماوس contour, string sign of contour of the terminal ileum in Crohn's disease. What are the treatment of Crohn's disease? Start by medical therapy, and then there is indication for surgery. Steroids are the mainstay of treatment, مثل ulcerative colitis, especially in active or treatment of the active exacerbation of the disease. These are effective in inducing remission in moderate to severe disease in 70 to 80% of cases. Steroid can also be used as a topical agent when the rectum is involved, with reduced systemic bioavailability, but long-term use causing complication of the steroid, especially adrenal suppression. They are better to induce remission than mesalamine, but have no role in maintenance. Patients suffering relapse are treated up by 40 milligrams of prednisolone orally daily and supplemented by 5-ASA compound in those patients with colonic involvement. When the Crohn's disease involves colon, نستفيد من derivative of the 5-ASA اللي هو قلنا mesalamine or sulfasalazine. What about antibiotic? There is no rule of antibiotic in ulcerative colitis. Like in Crohn's disease, there is who have symptom and sign of masses or abscess, also treated with antibiotic. Metronidazole is used, especially in perianal disease. Immune mediatory agent, azathioprine is used for, and it is additive and steroid sparing effect, and is now standard maintenance therapy, and it's considered as purine analog. Cyclosporine act by inhibiting cell-mediated immunity. Short course intravenous treatment is usually associated with 80% remission in case of Crohn's disease. Monoclonal antibody, infliximab, the monoclonal antibody directed to where the tumor necrosis factor. يعني يروح على الباثوجينيسيس، اوكي؟ يروح على tumor necrosis factor alpha اللي هو inhibit tumor necrosis factor, given to patients with severe active disease who are refractory to conventional treatment اللي هي الستيرويد or the derivative of 5-ASA, but it is very costly. What are the indications for surgery? Surgical resection will not cure the Crohn's disease, but the surgery is therefore focused on complication of the disease. This complication include recurrent intestinal obstruction, bleeding, perforation, failure of medical therapy, intestinal fistula. Fulminant colitis is very, very rare with Crohn's disease, like no indication for surgery. Malignant changes and perianal disease, these 8 indications for surgery for Crohn's disease. What are the surgery? The course of the disease after surgery is unpredictable, but recurrence is common. ولذلك the surgery, it is not curable for Crohn's disease. First procedure is ileocecal resection, is the usual procedure for ileocecal disease with a primary anastomosis between the ileum and the adjacent bowel اللي هو ascending or transverse colon. Second, segmental resection, when resection of the involved segment of the bowel, either short segment of the bowel will be resected or large bowel. 3, colectomy and ileorectal anastomosis when the colon is involved. Emergency colectomy, laparoscopic surgery, okay? Temporary loop ileostomy, proctocolectomy when it is extensive Crohn's disease involving the rectum and colon, can be benefit from the proctocolectomy. Structuroblasty, sometimes the surgery is restricted to the structure فقط, called structuroblasty. And anal disease, sometimes treated by fistulectomy or fissurectomy, and this is associated with the Crohn's disease. هاي مقارنة بين الألسراتيف كولايتس والكرونز ديزيز للتذكير اللي حكيناها احنا بالمحاضرة. مثلا ulcerative colitis affect the colon mainly. Crohn's disease can affect any part of the gastrointestinal tract, but particularly the small and large bowel. Ulcerative colitis is a mucosal disease, in superficial. It usually mucosa, whereas Crohn's disease affect the full thickness of the bowel. ولذلك هو يسوي لنا fibrosis, intestinal obstruction أكثر من الانتستان من ulcerative colitis. Ulcerative colitis produce confluent disease, يعني متصلة الانفلاماتوري بروسيس of Crohn's disease of ulcerative colitis. لكنه بالكرونز disease is characterized by skin lesion. Crohn's disease more commonly cause stricture and fistula, لكنه ulcerative colitis لأنه superficial affect mucosa only cannot cause stricture and intestinal obstruction or fistula. The granuloma may be found in histology in this Crohn's disease, لكنه ما موجودة مثل ما قلنا بالulcerative colitis. Crohn's disease is often associated with the perianal disease, لكنه بالulcerative very unusual involvement of the anal region in ulcerative colitis. Crohn's disease affecting the terminal ileum may produce symptoms like appendicitis, but it does not occur in ulcerative colitis. A resection of the colon and rectum will cure the patient with ulcerative colitis, لكنه بالCrohn's disease is not curable, associated with the recurrence in many cases. اوكي شباب، هاي محاضرتكم اليوم خلصت. اللي عنده سؤال يسأل.